Apologies for that. I'm going to go through this again, just so that everybody's clear about what's going on. So, the chair is unfortunately unable to attend the meeting today, so in accordance with the council's constitution, I will ask the committee for nominations to appoint the chair. Are there any nominations for today's meeting, please? Councillor Winstanley.
Okay, can we just clarify that none of the opposition members are willing to chair the meeting, please?
Councillor Williams.
Thank you very much. I don't know what's been going on because I couldn't hear any talking until now. So I don't know what's been discussed in there. I could see cameras on and mouths moving. In the pre-meeting, I confirmed that I wouldn't be able to chair this meeting as an opposition member, as I've been highlighted, because I have to leave at 1:30. And so it wouldn't be right for me to chair if I have to leave before the end of the meeting. In our pre-meeting, we did discuss Councillor Blundell taking this, taking the chair. And this was my belief in the emails that had been sent out prior to this meeting too. So I hope it's not going to be used as an opposition target. Thank you.
Thank you. The advice we received was that any member of the committee could be chair, just to repeat. So could I ask for somebody to second Councillor Blundell's nomination?
I'll second that.
Thank you. Does anybody object to Councillor Blundell taking on the chair from members? No. So we will start the meeting then with Councillor Blundell as chair, and we'll go from there. Thank you very much.
Good morning, members. I can see the Deputy Leader has a hand up. So, Deputy Leader, would you like to come in?
Thank you very much, Chair. I'd just like it registered that already I've put my hand up 4 times this morning and it's been removed. I did wish to register my opposition to you chairing. Objection to you chairing, Chair. I do believe as COSC, which is Corporate Overview and Scrutiny, it should be an opposition member in the chair. We are here to be challenged and scrutinised. And whilst I appreciate this is unusual, we've actually had a question from this committee, which I am assuming you've all made reference, you've all as a committee had insight into, and yet we're here with a Labour Party member in the chair, which I think is against good practice, and I don't think you should be there. Thanks very much.
Thank you, Deputy. I'll try not to take that personally, obviously. I know it's not meant in that way. Just for the matter of fact, actually, I wasn't in the meeting when this question was asked. So that's what I can see. Councillor Granville and Rachel's going. Councillor Granville, are you right if I bring Rachel in first? Because I feel she might have something legal-wise or give us some advice. Rachel?
Thank you, Chair. Yes, just to clarify again what Stephen said, that there is nothing in the Constitution that prohibits a replacement chair for a one-off meeting being from the same political party as a cabinet. This would be the same, obviously. I mean, there's SOC 3 where we have a Labour chair, yourself. So it's not an issue in terms of that for a one-off for any of the committee meetings. Although COSC is usually, as I said, an opposition, it is it is an issue for this particular one meeting. It's also, if I just might say, Deputy Leader, the reason I think we didn't push for you to come in with the nominations of the chair is that it would be for the committee to decide in terms of their chair without any kind of influence or input from the cabinet members. Thank you.
Thank you, Rachel. Richard, sorry, Councillor Granville.
Thank you, Chair. Just to inform you, I'll be leaving a meeting at 11 o'clock. I got another meeting with officers, but I will be coming back to it, to your meeting. Thank you, Chair.
Okay, no worries. Thank you, Councillor Granville. Councillor Amanda Williams, you've got your hand up.
Yeah, I just wanted to say basically what Rachel was saying about it being for the committee to decide, not cabinet members who chairs this meeting, and the email that we as committee members had suggested we should potentially look at one of the scrutiny chairs to chair this meeting, and that's where I believed we were going, and we had a pre-meeting which the cabinet members were not in, and it was agreed then. So having us try to be made fools of publicly is not going to go down well, and I don't appreciate it. We as a committee have already made these decisions, and it's not acceptable for us to be spoken to like that. Thank you very much.
Okay, thank you, Councillor Amanda Williams. I don't wish to spend too much on this item. I know because we've all got things to do and we've all got other meetings to attend, and we should really get on with the business of the day now. I think everyone who's wanted to level an objection has levelled their objections and thoughts and comments. So, Councillor Granville, you have your hand up again. You bringing it down? Thank you. So we will make a start on this lovely Monday morning. Okay. We're going to do this, haven't we? Right. So my opening statement, you'll all be happy to hear. We'll get this started. If the recording hasn't started, can we start the recording? Welcome to this meeting of the Corporate Overview and Scrutiny Committee, which is being convened as a hybrid meeting. This meeting is being recorded and will be available via the Council's website to be viewed subsequently. Everyone participating in the meeting will be accessing it either from the Council Chamber, Civic Offices Angel Street, Bridgend, or from remote locations. Should I, as Chair, experience any technical difficulties during the meeting, it's got Councillor Penhale Thomas will step in. I hope he will be here. I don't know if I can't see if he's in or not. Will step in to take over temporarily as Chair in my absence. Please, can everyone ensure that mobile phones are switched off or are switched to silent mode? Yeah. And members will have received an electronic copy of the agenda and will ask the officer to present a brief summary of the key points. For the record, the agenda can be viewed on the Council's website. Officers and members are reminded to refer to the page numbers contained in the public version of the agenda pack. Members and officers will be speaking at various points during the meeting, and those speaking may switch their microphones on at that point. But I would ask that members, with the exception of myself as chairperson, at all other times, keep your microphones switched off, as this will help minimise any background noise and interference. However, I would invite members and officers to leave their cameras on for the duration of the meeting, as agreed at the recent full council meeting. Obviously, not if you're in the chamber. Whether attending in the chamber or remotely, if any members or officers wish to raise a point or question, they should press the hands up icon on the screen at the top right-hand side of the Microsoft Teams window, and I will come to you in order I receive the requests. If you are in the chamber, please switch on the microphone on your desk and speak directly into the mic. Allow those who are remote to hear you clearly. Please lower your hand once you have finished speaking. The instant messaging chat button has been disabled for this meeting. Please do not use your microphone until I invite you to do so. Officers from Scrutiny will be supporting the meeting and will be monitoring the use of microphones throughout its duration, and where necessary, will mute those not being used. I will ask officers to introduce themselves. When I invite them to speak during the course of the meeting, they should ensure that all microphones are switched off when not in use. I will now thankfully proceed to the agenda. Agenda item 1, apologies for absence. I know we've had a few people who said they have to leave early. Councillor Granville, Councillor Williams have said so. So are there any other apologies for absence, Stephen?
We've received apologies from obviously Councillor Freya Bledsoe, Councillor Simon Griffiths and Councillor Gary Haynes.
Okay. Councillor Ross Penhale Thomas, you've got your hand up.
Yeah, thank you, Councillor Burdell, for taking the chair in these circumstances. Just to let you know, I'm around until 12, after which I've got competing commitments, I'm sorry, so I may have to leave. Thank you.
No worries. We'll hope we're all sort of towards the end of the meeting by then. Councillor Tim Thomas?
Yeah, exactly the same time frame. I'm afraid I got another deadline to meet at 12 o'clock as well, so I'll have to be excused then as well, sorry.
No problem at all. Let's hope we're still core at that point. Otherwise, we might all have an early lunch. Okay, now we've done apologies for absence. Declarations of interest. Do any members or officers have anything to declare? Councillor Lehman-Stanley.
Potential declaration of interest in agenda item number 5 with the Director of Social Services annual report. It does mention in the priorities for the forthcoming year libraries and the strategic plan, and that would be a personal declaration of interest in that. Thank you.
Fabulous. Thank you, Councillor Winstanley. I will put on record that I've received advice that on agenda item 5, from the report of the Director's Social Services annual report, as myself, I was a cabinet member in the previous 2 years, and so if any of the policies turn up, I may have to leave the meeting, which at that point we may actually have to end the meeting because we're not quorum anymore. But we'll cross that bridge when we get there. Okay, so I don't know if anyone else, Councillor Hugh David, I assume it's towards similar reasons as to myself.
Yeah, I'd like to declare similar interest to yours, Chair, on the same item. Because I was also a member of the Cabinet at the time on the Director of Social Services annual report. Thanks, Chair.
Fabulous. Thank you, Councillor David. Okie dokie. Right, we're going on now to agenda item 3, the verbal presentation by Cabinet members of the overview of their strategic direction and priorities for the coming year. I assume we're going to start with the leader and then go from there. I have had no other thoughts otherwise. So, Councillor Spanswick, over to you.
Thank you, Chair. And yes, I'll give you an overview, and not sure how much more you need to go into, but I'll start off by thanking you for the invite to this COSC meeting today. But I do hope that we can be respectful to one another and not return to the unfortunate situation that occurred at the last COSC meeting, where I had to leave early, and there were some unfortunate comments made to members of my Cabinet at that meeting, which were not acceptable and not acceptable. And I realise you may invite us here today to ask each individual member to identify their priorities. I'm sorry to say that's not how we work as a Cabinet team. And while each Cabinet member has a specific portfolio, it would not be appropriate for each member to have their own individual priorities. That's not to say they won't have areas within their portfolio that may be more essential to deal with than others, and they need to focus on ones, but they still need to work as part of a Cabinet team. It's not appropriate for us to have individual priorities, which one is more than the other. We are a team. So as leader of this authority, I'm happy to provide an outline of our priorities and respectfully request that you understand that at present we are spending as much time as possible looking at both the revenue and capital budget, which is inevitably going to produce some really difficult choices moving forward. But nevertheless, our priorities, the whole Council priorities, are the corporate plan and the 7 wellbeing objectives contained within it, and the medium-term finance strategy and the principles contained within that. And that's something the whole Council, every member of this Council voted on. And that is our priority moving forward. And if people want to refer to the corporate plan or the medium-term financial principles, they are there in documents we've all approved and all been before this Council in the past. And that are our priorities moving forward as we stand today. I'm not sure what more individual members can add to that from a point of priorities, Chair, but I'll leave that to yourself.
Okay, thank you, Leader. Do any other Cabinet members have anything they'd like to add? Anything they think Leader might have missed that you want to add in before I go to questions? I'm not seeing hands up and I'm seeing shaking heads. Okay, so we'll move on to members' questions. Obviously, we haven't really planned any questions because obviously we weren't sure how presentation you were going to give us today. So I don't know if members have any questions. If they do, raise their hand. Obviously, we will have the corporate plan and the budget and all those things coming towards us throughout the year, and obviously those things that we track constantly. So I don't know if any other members have anything they wish to add right now or ask. There's not a lot of cameras on, so I can't see if there's any shaking heads, but there's no hands going up. Oh, we could be up by 12 o'clock, he says. No? Okay. Fair enough. Send them into silence there, Leader. That's fine. Okay, I haven't got any questions because, again, wasn't sure how you were going to present it. So I will proceed to the next agenda item unless anyone has anything. I feel I'm just talking to myself. Everyone can actually hear me, right? Okay. Agenda item 4, information report for noting corporate plan targets for 24-25. I believe Kate Pask is going to be delivering this report. Fabulous. Okay, over to you.
Just a short introduction, as it is an information report, but the report in front of you aims to support further scrutiny of the corporate plan delivery plan throughout the year by giving an update on where we are at the moment, which is that business plans have been completed by the directorates, setting targets, which are included within the papers against the PIs and milestones against the commitments. Further to the process of conducting the self-assessment for 23-24 and the scrutiny process, and GAC also made some recommendations as well, Governance and Audit Committee. There are a couple of commitments and indicators that have been removed and also some that have been added, which are outlined in the report as well.
Fabulous, thank you for that. We do have questions on this item. We sort of planned in the pre-meeting. Councillor Amanda-Williams, you had a number of questions. So I'll bring you in first, and then we'll start with you, and then we'll go to others, come back to you, if that's all right with you.
Sorry, yes, it is. I'm just going through my screen. Sorry for the delay there.
No problem.
Yeah, I've got a number of questions. The first one was on page 8 of the cover report, and it was adding all of the committees felt that the aims were not fully supported, and so there were additional things added. And my questions will highlight where I don't think some of these have actually gone across to the targets, particularly in the education, but I'll raise that when we get to education. But I went through it on a page by page basis. And my first question, sorry, I've got them on my phone as well, my questions. If we look at aim 1.3, which is on page 12, I believe, of the public pack, it was to do with homelessness, and we've got the targets there about number of houses being threatened with homelessness, and they've got the percentage of people presenting as homelessness, and the targets are 10% on the bottom one and 29% actual. But I wondered, what is that percentage a figure of? Because it would be, I don't know, that doesn't mean anything to me because there's no numbers in there. So it would be better to understand the sort of numbers. Is the 10% of 2,000 people? Because of the rest of the targets, you can work out where the percentages come from. But these here, to me, the percentages don't mean that much. That was my first question, please.
Okay, thank you, Councillor Williams. Councillor Farr, do you want to answer, or is Janine online able to answer? Okay, yeah.
Sorry, I'll take that one.
No worries.
Okay. These two indicators that are under 1.3 aren't new ones. They're ones that are long-standing indicators for homelessness. So the indicators haven't changed at all really since last year. The thing with these ones that maybe is a little bit misleading is that one of them has a preferred outcome of being higher and one of them of lower. The one with the 10% target, for example, that's to do with people falling into that final duty category, which is that all other support that's been put in place has failed, and that's sort of the last part of when the duty fully falls on us. So that is why the target is low on that one. 10% is because the outcome is preferred to be lower. We were above target last year, and those indicators were red.
Thanks, Eve, for that. Councillor Amanda-Williams, do you want to go to your next question?
Yeah, but I'm still not sure what the 10% is in relation to with figures wise. It would be ideal to have an idea of how many people we're talking about there when we're looking at this plan. The next one was on number of pupils on the waiting list for specialist provision, and they've got that as actual 23-24 is 23, and it's a new target in 23-24, and looking at having 10 on the waiting list. Now, as a governor in 2 schools, I know that we are housing quite a number of children who should be going to these specialist provisions. However, there's no capacity. So 23 to me seems extremely low, knowing that some of these children are in mainstream schools, but they shouldn't be in those mainstream schools. And I understand they're sent there whilst they're assessed to decide whether they should be going to these this specialist provision. So for me, 23 there seems low, knowing how many from the schools that I'm governors of. So that's my next point.
Okay, thank you, Councillor Williams. Kate, do you want to comment?
I'm not sure if Lindsay is online at all, but I will try and answer this as best I can. My understanding is that in order to be on that waiting list, it's when you actually had some sort of assessment. So I think at any point the waiting list fluctuates throughout the year, but that 23 that we're looking at as the baseline figure was the level on the 31st of March 2024. And the aim, I think the 10 target is just a target that's been put in place because we do aim for it to be lower this time next year. So we're aiming, obviously, the ideal situation is that will be 0, but it's just, we're looking to show an improvement over this year with that indicator.
Okay, thank you. Councillor Williams, you happy with that?
I do have concerns that 10 is extremely ambitious because we don't have the capacity, and there are a number of children who are in need of this service. Obviously, with the budget situation, I can't see how we're going to get out of this to bring that number down at all. And I also have concerns that because of that situation, there are children who are ending up in mainstream schools and head teachers have no say in the matter. They're being placed in their schools and it's the wrong setting, and there are children now who are going into these settings for up to 12 months, sometimes even longer, or until they are removed from the school. So I think there's something we need to keep a close eye on, because at the moment I don't think we're doing all we can for these children, because they don't want to be in mainstream school, they want to be in this specialist provision, and I cannot see at the moment how we're going to get out of that.
Okay, or maybe we could, I don't see Lindsay on the invite list, nor the relevant cabinet member, I can't see him behind me. Make a note of that, and we can ask for a sort of a fuller response, and maybe something that SOC 1 could pull up later on, especially when we look at things like the budget and if there's lines for LRCs and MLDs in schools and stuff like that. So we'll come back to that one and make note of that one. So I'll come back to you, Councillor Williams, and we'll move on a bit, and then we'll come back, break it up a little bit. Councillor Martin Hughes, I have you down on my little list of questionnaires. Accuracy, I believe.
Yes, thanks, Chair. My questions are on page 24 and 25. They both relate to targets that have been set for the current year. The first one is the digital platform that we'd expect transactions to be increased by use of this platform. I note that the target that we've set for 24-25 is 72,500 compared to the target that we had in the previous year of 103,000. I think the target that has been set for 24-25 probably reflects current performance, but I think we ought to be a bit more aspirational, and I think logically we would expect an increase in digital use because of the investment that we've put into that infrastructure. Similarly, there's a question about the percentage of staff with Welsh language skills that target for the current year has reduced substantially down to 28% compared to 52%. So again, I think, from a layman's perspective, I think I'd be looking at something a bit more of an increase there. And I'd just be interested to receive comments about those two specific targets. Thanks.
No, thank you, Councillor Hughes. Kate.
Thank you. Yeah, if I address the first one, I think last year, CED 51, which was the number of online transactions, I think we set a target that was quite ambitious and didn't meet that target, which is why this year it's sort of been looked at as keeping the target in line with where we are. But the preferred outcome of that PI still is for it to be higher than that. So obviously the intention is for it to be higher, but I think maybe they were cautious in terms of putting it much higher because it was so much lower than was expected the year before. The other one, the Welsh language skills, is actually an interesting one. The target of 28% is actually showing that we want to have an increase compared to the outturn from last year, which was the 26.82. The target of 52% the year before was actually a bit of an error put in when calculating what we thought we could achieve, and so now we've looked at it again, looked at the data because it was a new indicator last year, and set the target based on where we are. It's one that's obviously dependent on the staffing levels at the time. It's not one we can really definitely have an ability to increase during the year. It is obviously based on staff's skills. Hopefully over time we will see that more staff that are within our staffing structure do have Welsh language speaking skills, but obviously we're in a situation where we have a vacancy freeze at the moment. We're not employing new people, so that will probably stay quite stagnant at the moment as it is, and because the staffing levels are what they are.
Thanks, Kate. Councillor Hughes, did you want to come back on anything there?
No, those answers address the points that I raised. Thanks.
Fabulous. Thank you very much. I've just received some advice, members, that due to the fact that we haven't got all the corporate directors or certain officers in the room here or in the virtual room either with us today, we're going to try and keep the questions to sort of very much about the accuracy of the data, because obviously Kate, while she's a very good officer and very good at what she does, she's not a jack of all trades. She doesn't know everything that goes on in the council. And obviously we can seek further clarification. We have sort of deeper questions from corporate directors outside the meeting as well, and we can definitely take note of them, but just to be mindful of our questions about of the subject matter and who we have available with us today. So on that note, I'll go back to Councillor Amanda Williams, as I said I would, and then I will come to Councillor David, because I know he's got questions from Councillor Haynes as well. So Councillor Williams.
Thank you very much. Yeah, and I think if we've got some of these, then we need to go through our recommendations if we can't get the answers today, because at the end of the day, we're here to scrutinise this report anyway. So regardless of whether they're here or not, we should then highlight these questions. So when I said about the initial report, mine was on about 3.2 with a cover report, and it said commitment 1.18, we will ensure that children and families across access support from the right service at the right time with the aim of preventing their needs from escalating. And then the second one, develop a 5-year plan to meet increasing demand on support services, specialist provision and schools. So whilst it does touch on it in the report in some elements, when you look at aim 2.2, and we're only looking at percentage of year 11 leavers, so I wondered why we're not also looking at the year 13 leavers, and more specifically from that, those with additional learning needs, because I think there's a tendency to forget those, for example, in Heronsbridge, who then move on to education in the colleges, which could save us money as a local authority, rather than having to put in specialist provision for them if they're going to try and advance from there. So I would have liked to have seen some of that in the report as well, rather than just focusing on year 11. So my question would have been, why are we just focusing on year 11? What are we doing to look at year 13 as well? Because there are a lot of people who are doing A levels or sixth form, but then they aren't progressing either. And we still obviously want them to progress further in employment or education as well, because not everyone goes to university afterwards. Do you want me to go on to the next bit?
I don't know if Kate, do you want to have any comments on that before we go on to the next one. Kate?
Okay, yeah, thank you. I can't really answer the question on why we've focused on the year 11 leavers rather than year 13. I think that probably is one for the corporate director to come back to you on afterwards. But what I will say in terms of what has been added, you can only see there what has been added. You can't see the other stuff that was already in there. The report is focusing on the changes that have been made then. I know in the other appendix you have all of the PIs there, but you are only seeing the PIs, not the commitments. So that there is an element of there being extra information there, which you will have seen previously, which isn't included in the report today. But I will come back to you on. I'll make sure that those questions are answered after the meeting for you.
Okay, yeah, we made note of them, and as you said, we'll try and put these in our recommendations as well as we can sort of for further information from the corporate director. Do you want to go to your next one before I move on?
Yeah, it was 2.5, and it was the performance indicators with regards to the staff reporting through survey that they agreed on strongly. I wondered why some of the targets are so low. We've got 42% for I feel every department is working towards the same common goal. And then we've got 48% for I feel that BCBC values its employees' ideas and opinions. To me, 48% is very low. It's less than half. And if we've already got a problem with recruitment, we need to be ensuring these targets are extremely high to ensure that our staff are feeling valued and are happy within BCBC. So I wondered why they were so low, some of those targets. Thanks.
Okay, thank you.
What I will say is with these ones, they have been set basically to show an increase over time, so that they're based on the previous survey that has been run. And at the moment, the last staff survey we had did have quite a low response rate, and a lot of these indicators last year in 23-24 were red and amber, because the numbers had dropped that were showing these positive responses. So we're very much trying to, over time, show this building up. It's one of those situations, again, where if we set a really high target and then they're all red, is that actually showing us anything, or should we just be trying to, over time, show an improvement? So with this one, we've gone for improvement over time rather than setting overly ambitious targets.
Okay, thank you, Kate. I've just been handed a little note you may have seen to say that the corporate plan delivery plan, God, there's too many plans, isn't it? Was scrutinised on the 21st of March by cost members. So it's a bit difficult now to add things in. I hope I've sort of summarised the note there. Thank you. I see that we have both the leader and Rachel wanting to come in. So I'll go to Rachel first, if that's okay, leader, and then I'll come to you.
Thank you, Chair. Yes, just to clarify again, I know, as I said in the pre-meeting, that we were made aware of some questions, but I think the point needs to be made that this is an information report. It is the final version, and in terms of making any changes, because Scrutiny has already had this and had the opportunity to make any comments on it, it's not like anything can be changed. The recommendations and everything were already made on this. So in terms of looking at this and scrutinising it, it's only really looking at it in terms of future performance monitoring. So I think in terms of questions, there's really not anything. This is an information report just to let you know that this is the final version. There's not changes that can be made at this stage on this. If there are queries or anything like that, I think the scrutiny officer is happy to make a note of them, and we can follow them up with the officers and the cabinet members if needs be. But I think the point is that this is just information and is a final version, so it really isn't for detailed questioning. We haven't, as the chair's rightly said, we haven't got the formal invitees here or anything, and nothing really can be done with it at this point because it is the final version. Many thanks.
Okay, thank you, Rachel. Councillor David, your hand was up, so I'll go to the leader first, and then we'll come back to you. Just because I don't want your hands being missed there. Leader, feels weird. I'm looking at leader, and I'm looking at.
Thank you, Chair. Well, first off, my apologies to the staff for not giving apologies for Councillor Martin Jones, who's unwell and been very well this weekend. So my apologies for his apologies for not giving that at the beginning. But just like Rachel just said, this item on the agenda, it's a bit unfair on Kate being sort of questioned on various detailed items there, because on the agenda, It's just for noting. The cabinet haven't been invited, no directors have been invited. So I find it strange how nobody's been invited, and then there's detailed questions. As Rachel just said, there's been a previous opportunity for this committee to provide detailed questions and to look at amending, and this item is for noting. So I find it strange that the cabinet shouldn't be here. We should all just disappear because we haven't been invited, and the same as directors here, but they haven't been invited. I'm just strange, but concerned where this is heading with detailed questions.
I think a bit of leeway is probably needed today. It's a bit of a the monitoring officer is shaking their head at me, so I'm just going to finish my point, and then we'll try and make some more progress. Obviously, it is a bit of a muddle today. We'll have the thing about who's going to chair the meeting. There hasn't been a chance for a chair's briefing or anything like that, obviously. So I think just a little bit of leeway is probably good. I know the monitoring officer is looking, which is why I'm not looking up. So we are going to try and make a bit of progress about no too detailed questions. If members do have detailed questions, I think it's probably best. I don't want to close down scrutiny, and that's the point I'm trying to make here, and try and bring them in, and so maybe via writing, email them in, and we can get those answers, because there are some interesting questions that need to be asked. And yes, I know members had the chance to scrutinise it in March. Some members were part of that committee, some members weren't, I should say. So, right, we'll try and make some progress, because we all want to try and get this meeting sorted. So, Councillor Amanda Williams, do you have any further questions about the report in its current state, or are these some more detailed questions that you've been trying to ask?
Well, yeah, I'm a bit confused now, because the cover report and throughout this we've been told, oh, well, these are the only changes since the last report. So that's what they're highlighting. Well, if they're changes, we haven't seen these before. So, and I've got 100% attendance record for all of my committee meetings, so I haven't missed one. So I'm concerned as to how we can't ask questions then, because like you say, this is scrutiny. We're here to scrutinise, and I see it's for noting, but this is the recommendations following our last meeting, and these are the changes following our recommendations. So we made our recommendations. These are the changes now, and we're not allowed to ask questions on these changes that were brought in because of our recommendations. So, because I did have a couple more areas, and I think they need to be looked at, particularly for next year's targets. Otherwise, we're going to be in the same position. We're told, well, this is it set. You can't ask these questions because, and if it can't be changed, then I think we need to look at that, because, I mean, one of the examples for myself was about on WBO 4.1, the primary school attendance and the secondary school attendance. Our targets are lower than the national targets and cluster targets. So, it's things like that that I think we need to somehow bring up, and how we do that, I don't know, but we need to be looking at this. We've got a healthy agenda today, and yet I don't see the point of putting some of these things on here if we can't challenge some of the things that we've asked to go in there. Thank you.
Okay, thank you, Councillor Williams. Rachel, you've got your hand up.
Thank you, Chair. Might I suggest to Councillor Williams that we make a note of these, and as I said, you're right, in terms of these things can certainly be looked at towards how we're looking at it for next year. So might I suggest then that we look at how we can factor it into the forward work programme. I can make a note of all your queries following the meeting if you send them through to the team, and we can certainly take those forward and see how we can raise them and with what future meeting we can take that up in. Not a problem at all.
Okay, thank you for that. If the committee are happy, then I think that's probably the best way to proceed now, because that's just where we are now. And we got, the social services annual report, which is the healthy item, and I'm sure members have lots of questions on that. So does anyone have any questions following the advice that Rachel has given and Stephen and Kelly has messaged me? And if not, we'll move on to the next item. We can pick a load of these up in our recommendations for scrutiny committees to look at, and for further information if so needed. So raise your hand, or if not, don't, and we'll move on. Fabulous. Okay. Next item on our agenda then. Thank you, Kate, I should say. Thank you very much for that. A bit muddled, but we're getting through. Okay, okay. So our next item on the agenda is, as I said, the Director of Social Services Annual Report for 23-24, the one we've all been waiting for. I believe, Claire, Deputy Leader, you'll be giving the presentation.
Thank you very much, Chair. I'm sorry, I was just messaging a couple of colleagues to tell them to come down because I'll be joined by Jackie Davis, who's Head of Adult Social Care, and David Wright, who's the Deputy Head of Children's Social Care for this agenda item as well. I'll just give you a sort of very brief introduction, if I may, to the report, because I know that you'll want to get into the questions. So as scrutiny members will know, the Director of Social Services Annual Report is a statutory duty which falls on myself to advise Council on an annual basis around the effectiveness of social services and wellbeing in the county borough. So this is the annual report for 2023-24. And what I would say in introduction is, obviously, we're now in September, so some of the things that are reported in the annual report have clearly moved on since the last financial year, but it's important that there's a full record in terms of the last financial year. The report itself, it has to comply with guidance issued under the Social Services and Wellbeing Act Part 8, so it is a lengthy report, and I apologise for that because I know it's a lot of detail within there. We have tried this year to make it as user-friendly as possible and to illustrate with case studies, but as ever, feedback on the format of the report as well as the detail within it would be very helpful. There are matters that the report has to set out. So the report has to set out a summary of regulatory activity which has taken place in the previous year and make sure that is formally reported to Council. So you will see, and it does seem quite a while ago, that there's reference in the report to the joint inspection of child protection arrangements in Bridgend, which took place back in June last year. So that's reported within the report, and significant progress has been made in terms of the recommendation of that JICPA across partnerships, but this is particularly around the social services. The report references the inspection of fostering services in the county borough, and again, there was quite a number of strengths identified, but some significant areas for improvement as well. And progress is being made in that area, and also references inspections of other regulated services in both adult social care and children's social care, which have largely been positive inspections there. The report has to highlight both good practice and areas for improvement, and those are set out within the report. I think at a very summary level, I would say that the report evidences quite significant improvements over the last year in our children's social care. It evidences that our quantitative performance particularly has significantly improved and continues to be at a top quartile level of performance in Wales in terms of quantitative performance, and that's against a backdrop of significant levels of need and demand coming into children's social care. And so the workforce particularly, and managers who've managed all of that demand and need in an effective way, are to be commended for their actions. The level of quantitative activity that we've undertaken does impact on occasions in quality terms. So the report does highlight that there continues to be some variability in quality, but we have endeavoured to improve our quality assurance mechanisms. We've implemented signs of safety and are endeavouring to embed signs of safety as the model of social work practice. And when we come to full council, we're going to play for council, if it works this year, a video which will show how we're doing that, and that we share with families now in our conferences. And so that's making a significant impact. And we've also improved significantly from a workforce perspective. So we've talked for many sessions in these committees about the challenges of retention and recruitment. We are in a far better position around that in our children's social care services, and particularly like to pay credit to our international social work recruits. That we got now 13 within children's social care who've travelled from far and wide to work with us and be part of our Bridgend family here in children's social care, and they're making a real difference in terms of the work that they're contributing. In terms of adult social care, again, it's been a year where We've largely seen very good performance, and we haven't had any overall regulatory inspections, but one of the probably the highlights of the year was the engagement activity which Care Inspectorate Wales carried out in our integrated dementia service in Bridgend, and they found, you know, immense positivity in terms of the impact of that service on both individuals and carers, and that was a real positive. In adult social care, again, from a safeguarding perspective, we've seen increases in terms of contacts coming into the service, and we have had some challenges in part of our services. So again, it's probably quite well rehearsed around the challenges at the interface between hospital and community, which can sometimes result in delays in people receiving their next stage of care, and that's set out in the report. And we've seen challenges in areas like our learning disability services in terms of sort of transformation of those areas from some of the levels of support that needed to be provided during the COVID pandemic. So the report sets all of that out and sets out a clear way forward. And as the report says, there are clear 3-year strategic plan to progress those improvements further in children's social care, and Cabinet will consider in the autumn a similar aligned strategic plan for adult social care. We continue, I would say, to have leading edge practice within our prevention and wellbeing services, you know, much delivered in partnership, you know, excellent outcomes in terms of our new contract for carers wellbeing, you know, really good set of arrangements with our partners in Halo, and we've received another excellent accreditation, you know, independent accreditation through the Quest process for our leisure services. We've managed to grow the number of local community coordinators who are doing sterling work in preventing people's needs escalating to that next level. So all of that good work is set out within the report, but hopefully the report does give you sufficient in terms of the areas that we need to continue to improve around. And what I was at pains to do this year is to set out the risks to that continued improved performance. So I'm sure there will be questions around the budget. I always receive them, given you know, that the level of overspend which is reported within this report has been reported to council, that the directorate contributed to at the end of the last financial year, and there continues, despite the very significant support that social services and wellbeing have received from this council in Bridgend, which have enabled us to continue to meet statutory duties and to address some of the really key pressure areas that we've got, such as children workforce. You know, the financial position that this council and public services find themselves in, and what that means for social services in Bridgend is a significant risk for the continued provision of social services and the continuation of meeting statutory duties, and that is set out within the annual report in some detail. There are also risks in terms of ongoing in terms of workforce in adult social care, around care workforce, and those are set out. We also have risks which have been escalated to the corporate risk register around the fact that we're in the process of securing and then need to implement a new system, a new case management system across social services and early help services. Any system change is a challenge. Doing it in very tight timescales is a particular challenge, and we're working with regional and national partners to try and manage and mitigate those risks. So overall, hopefully, Scrutiny will agree that the report demonstrates progress, but it's progress which I would advise Scrutiny Committee is at some risk because of the issues that I have set out. And I'd just like to conclude again on a positive by thanking the workforce across social services and wellbeing, who go above and beyond every day, working in some of the most challenging circumstances in the county borough for what they do, and hopefully that credit to them is reflected in the report as well. So if I pause there, Chair, it's probably quite a long, brief summary, but it's obviously a very detailed report. Thank you.
Thank you for that, Claire. Deputy Lead, do you have anything to add?
Thanks very much, Chair. Claire talks about her overview, is it? Is it overview ended up calling it? She talks about a brief introduction. It wasn't an introduction. It was 19 pages when she first sent it to me, and I said, that is no introduction. That's very definitely an overview, and possibly we need to change the wording. I do think it's all credit to our staff, particularly Claire, our senior officers, and all our workforce in social services and wellbeing, that despite all the challenges that we face, they continue to deliver effectively, professionally, and in a transformational way. And I say transformational because everything is changing in social services, and it has done for some considerable time now. And that in itself is a challenge because people don't like change. But I wish to express my Cabinet colleagues' thanks and commend all our staff and our partners for their positive ways that they continue to support our residents. And I think that's the important thing, is to continue to support our residents. Claire also referenced the international recruitment. I've had some interesting conversations with our international recruits who, and I quote, state they can't believe that we do so much in the UK for our residents, because coming from abroad, social services is very different, and what they deliver is very, very different. They said we are so supportive of our residents and they've never seen anything like it. So they're really enjoying working for us because it's something that we like to do. Thanks very much, Chair.
Thank you very much for that, Deputy. I think I speak for the whole committee when I join you in thanking your colleagues in social services. They do a remarkable job and they deserve all the praise that they can get in very difficult circumstances. So moving on to the questions, I have got obviously some sort of questions that we sort of looked through in the pre-meeting, but I'm going to take members, we'll just start with the cover report and then go into the main report. So does anyone have any particular questions on the cover report before we start going into the report? Just raise some hands for us there. Easy. Councillor Amanda Williams.
Thank you very much. It was, right, firstly, I want to echo that the report I've seen, you can see it, there's vast improvements in the Directorate. And again, I want to just congratulate all the staff involved. It was simply on the financial part of the report. I think it was 74 pence, isn't it, in a pound now we're saying that we're spending on education and social services, and about the overspends. And that is obviously my biggest concern here, is these are statutory services and you can't just keep taking the money from other services to top it up. So my concern is how we are going to achieve all of this, because we are achieving a massive amount of work and doing wonders with residents, but how we're going to sustain this and continue to make these improvements when we're not receiving any extra money for it. And I think this is the same, isn't it, across all local authorities. They're all struggling with the amount of money that's being provided for the services that we have to give to our residents. So that was the only thing I picked up on the cover report.
Fabulous. Thank you, Councillor Williams. Claire, Deputy Leader, who wants to take it?
If you don't mind, Chair, I wouldn't mind giving a brief bit of introduction. Thank you very much for the question. Firstly, Councillor Williams, as you'll be aware, we have a Social Services Improvement Board. One of those things that we discuss is budget. And we know that we were overspent. We knew that we were overspent 2.5 years ago at the beginning of the pandemic, when we knew that we were going into special measures. Part of that reason was around the resource that we didn't have in social services. I think first and foremost, council are well advised and aware of that position. What we are seeing is trends changing now. You will all be aware that children's services was our biggest challenge and our biggest demand on services. That's actually reducing now, and our biggest challenge is in adult services. And we are looking at the way we are delivering adult services. That's not because we don't want to just do to people. Part of that is around actually what can you do first? What can you do for yourself? Because the more you can do for yourselves and the healthier that we can keep our residents, then the better outcomes we're going to have in the future. I think one of the things that I would say to you is you've all seen the population needs assessment that has been presented to council previously. We know that we've got an ageing population, and we know that we've got more and more dementia residents suffering with dementia out there in our communities, which are also going to cause significant demands on future provision. So we need to look at how we're going to do that. And one of the things that we need to do is get our residents to look after themselves better. And I say that with the greatest of respect, but our residents have some really unhealthy lifestyles. We know from all our data that we have got one of the unhealthiest populations in the UK, if not Europe, here in Bridgend County Borough, specifically one area of the county borough, and our regional position in Cwmtaf is not very good either. So it's wider than just us as a council. It has to involve all our partners, and all our partners have a part to play in reducing that demand, but so do our residents. So, you know, I'm not saying that we're not delivering. What I'm saying is that we won't be able to sustain what we're doing and the way we've been delivering it for year on year, and we have to change the way we're delivering. So you'll be aware, you'll all have seen the children's plan, the 3-year sustainability plan. You'll have all seen the adults 3-year plan, and you've got the LD plan coming shortly to Scrutiny, so that you can have a look at that as well and give us any advice, guidance or challenge that you wish to. Thanks very much, Chair, and I'll hand over to Claire.
Fabulous, thank you, Deb. Claire?
Yeah, thank you very much for the question. What we're trying to do in social services, I think first and foremost, is get ourselves back in year as close to the budget that we've been given by the council as possible. So we benefited, didn't we, during the budget that council approved last year for some significant pressures, and where those pressures have been spent are set out within the annual report. The biggest proportion of them did go into the increases in pay and prices, and this is an issue not just for social services, it's an issue for all parts of the council, all commissioned services, where inflation has been running very, very high. Welsh Government have introduced the real living wage for care workers, and they've been significant and very welcome from a retention and recruitment perspective, increases in the real living wage for care workers, but all of that comes at significant cost to the council. So a big part of the increase that we had went into those increases in pay and prices. A significant amount went in to address the issues which had been identified in terms of sufficiency of the children's workforce and the operating model in children's social care, which, as the Deputy Leader has just said, is now starting to pay dividends, particularly around how we're managing the needs at the front door very differently with that integration with early help, far less children and families progressing on to statutory intervention, significant decreases in our child protection register particularly, and significant decreases in those who are progressing through legal planning processes. Smaller increases in the numbers of care experienced children, but we would expect that over time to see less of those very expensive placements, which is the biggest remaining area of budget overspend. In adult services, as the Deputy Leader has said, we received some investment in terms of the challenges around learning disabilities home care services, where we had seen significant increases in need and some increases in older persons residential, reflecting the ageing population and the impact on the population of COVID. So our recovery plan in year, if we remember at Q1, we were just over £6 million overspent as a directorate, is bringing together a range of actions to try to reduce that in-year overspend. We then come on to next year, and I think that's why my report is framed as it is really in terms of what the council needs to continue to do around the statutory duties, which are considerable, placed on us as a council in terms of social services and wellbeing. In fact, there have been 2 new codes of practice published in the last couple of weeks around the Social Services and Wellbeing Act, which have strengthened those codes of those statutory duties on us, and you know the numbers of musts are into close to 100 around new statutory duties coming to us. The report references the new Health and Social Care Bill, which is currently in the Senedd, which will eliminate profit from children's social care, and the resource impact assessment of that, and what it will require in terms of investment from local authorities into providing children's social care in a different way is considerable. And all of those things are hugely challenging. So as the Deputy Leader has said, we are transforming what we do in children's social care, in adult social care, but all of that is within a financial envelope, which if that reduces significantly will cause huge challenge to the council being able to meet those statutory duties in a timely way. So it's a time then I don't think I've ever been as worried, despite the fact we've been through austerity previously and through huge challenges over the last number of years. I've never been as worried, and my colleagues across Wales have never been as worried about the ability, despite all the transformation, despite all the work we're doing to recover the budget position, never been as concerned about the ability to meet the growing number of statutory duties on us. And that's a very honest assessment of where we are at the moment in terms of the budget position.
Fabulous, thank you for that. I see hands have been going up as you've been speaking, Claire. So, Councillor Ross Pennell Thomas first.
Diolch, Chair. Can I just echo the sentiments, first of all, of fellow colleagues in welcoming the report and to thank all members of staff in the Social Services Directorate, the energy and the effort that goes into providing services day in, day out, night in, night out to some of the most vulnerable people in the county borough. I don't think we can underestimate, so a big thank you. Just a quick overarching question, Chair, to open up, and Claire, you've touched on it, and Councillor Williams has touched on the budget as well. The Social Services Sustainability Plan for Children's Services in particular, it's referenced to some degree throughout the report. I'm just wondering, is that having the impact that you thought it would, the £3.5 million that's now part of the base budget, as decided by Council roughly 12 months ago, and the sustainability plan that stretches the 3 years? I know we're covering up to the 31st of March, but it would be strange not to comment for the last 12 months. Is it having the impact that you thought it would? Is that money having the impact you thought it would? And is the sustainability plan as is now compared to the last 12 months when it was first written? Is that as viable as it was then, given the context that you've already spoken about, the complexity of cases coming forward and also the continual financial challenges that the council faces? Thanks, Chair.
Thank you.
Yeah, thank you very much for the question. I would say overarchingly, yes, the 3-year sustainability plan is having the impact that we had intended. We spent a lot of time in looking at the impact and outcome measures within that sustainability plan, and those were built in. And at the end of the financial year, we did the first, because it was approved in September, wasn't it, by Council and Cabinet. At the end of the financial year, we did a 6-month overview and evaluation, which went to Scrutiny Committee, and we'll do one now for the next 6 months, and that's what we'd agreed with with Overview and Scrutiny Committee 2 in terms of reporting back there. The indicators that I can point to in terms of showing that impact, firstly around the investment in the front door, in that despite the fact that demand has not reduced at the front door and remains very, very high, how we manage that demand has changed fundamentally. So what we've seen is a significant decrease in the number of safeguarding strategy meetings, because people are being signposted in different ways. That has then resulted in less statutory assessments, both care and support assessments, and less what we call Section 47 safeguarding investigations. That in turn has resulted in reductions, a safe reduction in the number of children on the Child Protection Register. And we do a lot of qualitative work to make sure that is a safe reduction. And we have been, one of the performance indicators we're particularly pleased at is that we're seeing quite a low level of re-registrations, and certainly lower than our regional partners in terms of re-registrations onto the register. That in turn is resulting in less children and families being subject to the legal planning process, so going into court en route to becoming care experienced, and is then resulting in a smaller reduction. And the area that we're probably most concerned about at the moment is that whilst we are seeing a reduction in the number of care experienced children, that is a smaller reduction, and that is the part of our service which is the most pressured at the moment. The other thing I'd point to in terms of that investment in workforce, one of the things that we said to our workforce is that your caseloads need to be reasonable. We didn't commit to giving them the lowest caseloads in Wales. We can cite other local authorities that have lower caseloads, but they had to be reasonable caseloads that enabled people to have enough time to do the job and to build those relationships with families in line with our model of practice, in line with the investment we've made as a council in science and safety. And that is making a real difference. Staff are staying with us, and staff are coming to work for us. So we were very, very pleased in the last month to step down the managed team that we had at the front door of children's social care. Our agency numbers this time last year were in the 70s, they're now in the 20s in children's social work, and that's all as a result that people now want to stay and work in Bridgend and are getting a good and very supportive experience. It's not to say there isn't more to do because of the issues that I'm highlighting now around having to make these big changes in terms of the eliminate profit agenda and having to do more, I would say, in terms of our care experienced team, our 16 plus team, and some of the work around fostering where we have lost some of our foster carers. So that's our priority area at the moment. But largely, I would say that the plan is having that desired impact and has made a huge difference to the lives of children and families who aren't being subject to so many statutory processes. I know that's quite a full answer, but Dave is here as well and might want to add something.
No, I think you covered it clearly. Thank you.
That's what I'd like to hear. Thank you, Dave. Okay. We'll go to our next question here, which is Councillor Hugh David. Councillor Hugh David, you're up.
Thanks, Chair. And this is a question from Councillor Haynes, who couldn't make today's meeting because of a personal family emergency. So his question is about finance, and that is, given that the most significant risk identified by the Directorate to Social Services and Wellbeing in the County Borough's financial, given the £11.2 million overspend from adults and children's services, and the list of actions to be taken as part of the budget recovery plan, can the committee be provided with a detailed plan along with timelines and expected savings to be made, and confirmation if this budget recovery plan will recover the 11.213 million overspend identified or not? If not, what other actions are planned to recover the budgetary position? Sorry, that was a long question. There's a lot more actually detail here, but I won't read it all out. And I know you partly answered that, but what I would summarise that question to be is the detail in that and bringing it together in one place, because obviously it is referenced throughout the report, because the report is not obviously just about finance, it's about a range of outcomes and quality of outcomes, etc. Thanks, Chair.
Thanks. It's a detailed question, but it's the right question. So we have got a recovery plan which we took into the Social Services Improvement Board last week. If the scrutiny chairs are so minded to want it on their forward work programme, I'm sure that we could bring. There's a lot of detail in there. Jackie is chairing the recovery board for the Directorate, and I know had a meeting last week. So I don't know, Jackie, if you want to update on the recovery plan.
Yeah, so in terms of the recovery plan, we're going to do that in a project managed way. And in Q1 of the current financial year, our overspend was £6 million. So there's a difference from the 11 that's detailed in this report. So what we're looking to do is to reduce our spend in a way that brings us back to a balanced budget. Now, that's an ambitious target, given that we are a demand-led services. So we're looking at all ways of doing that, from grant maximisations to implementation of our practice models. It's looking at our agency spend. There's a whole raft of things. So we would be happy to bring that into a future scrutiny in terms of the detail.
We can definitely make note of that. Obviously, the chair of that committee is not here today, and I'm not sure who else is on that committee, but we can offer it as a recommendation to them to see if they want it on their forward work programme. Stephen's making notes and he's nodding at me, so we're all good. Right. Councillor Martin Hughes, you've got your hand up?
Yes, thanks, Chair. It's on the subject of finance. I was going to bring it up in a different section, but I think it's probably more appropriate now. It's the recognition of the Shared Prosperity Fund, which is a UK government initiative. Obviously, we don't know where we stand year to year on that, but it's encouraging to see that a number of projects have been funded in social services and well-being, including the prevention and well-being side of things. I think what would be useful if Claire could give some more information about the perhaps the number of projects that have been funded through this source of funds and the approximate monies that we've received to enable those to be carried out.
Who wants that?
Yeah. I can come back with the exact detail. I think from the start of the Shared Prosperity Fund, there's been investment in the creative industries through Arwen Cultural Trust, and that was the first sort of initial big area of investment. I don't know the exact amount of money there, but Sophie, who sat beside me, is having a look, and if we don't get it before the end of the meeting, then we obviously will share it soon after. I'm pleased to say that in year and very recently, we've been looking at how we could work with colleagues who are managing the Shared Prosperity Fund, perhaps to have more of an impact on some of those areas within the social services part of the budget, where people are on pathways towards employment, education and training, but that had been funded from core budgets. And in year, we're benefiting from £600,000 of slippage just recently moved into our area as a result of some work that we've been doing there. So that's really pleasing and will be a considerable contribution towards the recovery plan that Jackie just talked about. And we're very, very keen, not knowing what the future looks like, but to be prepared for whatever the future does look like, because many people with disabilities have the same aspirations as everybody else to employment, occupation, meaningful daytime activity. And there are lots of examples through predecessor funds to SPF of this sort of funding being used to support those sorts of individuals into the workforce, and meaning that they move away from that reliance on statutory day services, which are more activity rather than employment and training based. So we're very keen to be doing that work now as part of our day opportunities review, so that we're ready for whatever the future funding streams look like.
Fabulous, thank you for that. Councillor Hughes, I can see you nodding. Fine, fabulous, okie dokie. Before I go on, Councillor Tintos, I saw your hand was up and then it went down. I'm just making sure that you took it down and it hasn't the magic.
Yeah, thanks, Chair. My question related to the main director's report. I can wait
Fabulous.
if you think it'd be more appropriate.
That's perfectly fine, thank you. I just wanted to make sure it was you and not the elves and whatever happens in this meeting. Councillor Amanda Williams, you're next.
Thanks. Mine isn't the cover report, it's the main report as well, but I put my hand up ready thinking we might move on to that, but I'd lower it for now.
Okay, no problem. I'll just check with Councillor David to see if he's for the cover report before we move on.
Yeah, well, it was coming back to the question of finance, and given the central importance of the sustainability of the finances of social services to the finances of the authority, I think it would be helpful if we would have sight of that recovery plan, and perhaps it's more appropriate to come to corporate overview and scrutiny, given it needs to be looked at not only through the service lens, but through the subject overview and scrutiny committee lens, but also through this corporate lens. And I very much welcome the fact that that recovery plan is in place. And I was going to ask a question then around, I think it's a broad brush question on the covering report, and that is about the use of the term exponential growth in demand. Now, I know inherently the challenge around discussing this report is that it's at a point in time, isn't it? We've moved on from that point of time, but I wanted to ask where we are in terms of inquiries through the front door, particularly around children's, because that does seem to have continued to rise, but hopefully it's stabilised and we seem to be able to manage that front door much better. But I wanted to understand if the number of initial inquiries have continued to rise since the publication of this report, and what else can be done to manage those inquiries through the front door, because even if they are being even if they are being triaged and dealt with in a more effective but still safe way, the very fact that we're having those inquiries through the front door is a resource implication, isn't it, through the multi-agency safeguarding hub. So I wanted to ask a question about that as well. So sorry, I've slipped into 2 questions there, Chair.
That's fine. Claire, did you want, or Deb, or Dave? There are a lot of potential fingers going, so I'm just... Go ahead, Dave.
Thanks, Councillor David. In terms of the level of demand that's coming into the front door, it's still exceptionally high. On average, we're receiving around about 1,000 contacts a month. But with the restructure that we've gone through in terms of early help services becoming a part of social services and wellbeing, our ability to signpost and maximise the resource that we've got available is now increased. So we're managing that demand effectively, as Claire's already alluded to, utilising the resources that we've got through early help services, but also with our partners and identifying more appropriate services that are better placed to meet family need then. As Claire's already touched on in terms of the child protection processes, they've reduced because of our ability to kind of work with some of those partners and utilise that resource, as I've already alluded to. There is an implication, as you say, in terms of the demand and that time that it takes for us to process that. But most importantly of all for me is that we know children and families are getting the right support from the right service at the right time now, whereas maybe historically we had issues where children and families weren't getting the support, and then we ended up with the escalation leading to child protection processes and into those kind of arenas, really. So it's certainly more streamlined in our approach to managing that ongoing demand. In addition to that, we are working with our partners to make sure that they're clear around what an appropriate referral looks like and what we'd anticipate to see from a statutory perspective, but also ensuring then that information and advice gets out to partners, but also out to local communities as well in terms of what's available to them rather than coming into the local authority directly.
Thank you for that, David. And obviously on your question about where the recovery plan goes, we can talk about that obviously later in the meeting, and whether it's here or SOC 2, we'll try and find a space for it because it is rather important, as you highlighted. Okay, now we're all done with the cover report, and I know there are plenty of people waiting to get into the actual report. We're going to take each section of the report and we'll do the questions that way. So although we have really just done the director's overview, we'll start there. If anyone has any questions on the director's overview, which is pages of the pack 41 to 58, put your hand up. Trying to add some order to this meeting. No, fabulous. Okay, then summary of performance, which is pages 59 to 64. Oh, so they're all later in the report. I can probably figure out where. Okay, next item, how people are shaping our services, pages 65 to 80. No, okay. Adult social care, pages 81 to 95. There we are. Councillor Amanda Williams.
Sorry, going through between screens. I'm not sure what pages I can't find what pages my questions were on. I had 3 questions on the cover report. One was about the discharges from hospital, because that's in the report. And I wondered if, because I think since the old Community Health Council and it's moved to Llais, there's more of a view of social services and health being linked so that you can get a better service with that. But I wondered if we're still having the same issue with regards to people being discharged into the back home when they're not really ready for it, but because there's a lack of beds, and what we're doing with the community, with the health board to ensure that only those who are being discharged are being discharged. And particularly, I know from people who have been into hospital recently as well, I've been contacted with regards to issues, simple things such as the food and the menu there, and how they feel that people aren't getting stronger and healthier because of simple things like they're not being given the specific dietary needs that they should to make themselves stronger and discharged as well. So I think that all has an impact then if they're just being sent home and they're not fully fit, that we have to pick up the tab for. So that was my first area. And then I had one on learning disabilities. as well. Thank you.
Right, no problem. We'll take the first one first then. Claire?
Yes, so in terms of hospital discharge, we've actually got a very detailed report which is coming to the next overview and scrutiny committee 2 on that, which I think sets out some of the ongoing challenges that are faced around that interface between hospital and community, the work that we're doing, you know, the fact that it is very integrated. Jackie chairs a regional integrated discharge board, which is leading this work, not just for Bridgend, but across the whole of Cwmtaf Maganog. And when it comes into overview and scrutiny committee 2, we're going to have a senior colleague from the health board as well. So in terms of concerns about the hospital and what they are doing with people, be able to ask that directly to a health colleague. I think what I would say in terms of all of that interface position, what we see is that the longer somebody is in hospital, then obviously the greater demand coming onto social care, because the more that they become disabled during that period in hospital, the more deconditioned they become, the more recovery that they need. So a lot of the actions you see reflected in our report around resetting our reablement services, you know, making sure that people get that opportunity to recover in the community when they come home, and that bit of support, but not necessarily the long-term package of care, are all because we know that a period in hospital can be so detrimental for an individual in terms of getting back to whatever their baseline was before going into hospital. But as I say, there'll be that very detailed report which is coming to next overview and scrutiny 2.
Thank you for that. And maybe something to think of, we can have a, not bring it to this committee, but we can have, members of the committee are made aware of when the report's out. So we can have a look as well. I think that's because Jackie, I can see you're waving.
Sorry, I was just going to say the report's coming on the 23rd of September, so it's being finalised. So it'll go out towards the end of this week. So
fabulous. Then we look forward to reading it when it's out. Thank you very much. Councillor Manuel, I'll bring in Councillor Thomas and then come back to you, just so you get to have a break as well of asking you questions. Councillor Thomas.
Thanks, Chair. I got 3 questions. 2 relate to the international recruitment of social workers, if you feel that's appropriate. Yeah. I think firstly, I'm assuming it is. I think firstly, it's really innovative approach, especially given current difficulties in the recruitment and retention of staff. Just need some clarity really in light of potentially difficult post-Brexit rules on migration. And firstly, I just want to know, the Deputy Leader said that these recruits from international countries have said that we provide lots more services than in their countries. Firstly, just wanted some clarity on what these countries were, because it's important so we can benchmark. The report does mention Zimbabwe. Just wondered if I could have some bit more clarity on the countries. But my second question in international recruitment was, in lieu of the difficult migration laws, do they have indefinite right to reside from the Home Office, or is this a temporary solution? Is it like a sort of temporary visa? If I may, my third question doesn't relate to the report. It's just the Deputy Leader's comments about people having to have less reliance on public services and to adopt more healthy lifestyles. I completely agree. Just wondered, could I have some clarity on what healthy lifestyles they should be adopting? And really, does she think there's a role here for elected members as community champions to act as an example in demonstrating these healthier lifestyles? Thanks, Chair.
No problem. Deputy Leader, the floor is yours.
So firstly, I wouldn't tell you where all our staff come from, but America and Africa. I think it is the mainstay of the majority of our international recruits. They're all on work visas, so Brexit isn't a problem for them because they don't come under Brexit. It's international visas. I'm not quite sure what else you wanted to know from me. Sorry, Councillor Thomas. Oh, healthy lifestyles. Do I think we should? Yes, and I should probably give up smoking. But then I've already given up drinking and I'm not giving up smoking at the same time. Sorry, Councillor Thomas.
Well, Deputy Leader, it wasn't personal to you, of course. I'm saying holistically, us as members, what is there any way we should lead by example?
So one of the biggest healthier weight agendas for our population, Incwm Taff Morgannwg, is diabetes, and that essentially is people who are overweight, eating unhealthily, and if they can do some more about that, actually they'll stop going into type 2 diabetes, so being more active, looking after yourself, and yes, smoking is one of those, Councillor Thomas, which is why I referred to myself, because it's something that I do need to do, but I really haven't got the capacity to do all of it all at the same time. Thank you.
Thank you very much. I think we'll leave each other's personal habits to each other, I think. Otherwise, this meeting will take even a weirder turn than it already has today. I have been reminded that we need to take a break after 90 minutes. I'm going to bring the director in, then we'll have a quick 10 minutes, and then those who need to go can go, because I know some members have to go as well. So, Claire.
Yeah, I just wanted to take the opportunity to highlight the excellent work and the opportunities that are available through our Healthy Living Partnership for all ages of the population, for people with pre-existing health conditions through all of the exercise referral schemes, the Super Ages programme for those of us who are getting on a little bit, all the active young people work that's happened over the summer and continues to go on. So, it would be great actually, and it's already funded, and so it's not going to cost us any more if members could champion all of that within their local communities. We know that we've got life centres in those parts of the county borough with the highest health inequalities, and yeah, any more that information we can provide for members or anything more that we can do to promote what is available out there would be a real positive.
Fabulous. Thank you very much for that, Claire. And as promised, we'll take 10 minutes. All right, 10-minute break. Look, dead on 11:30, so we'll come back at 11:40. And if you need to go, feel free to go. We'll stop the recording. I'll bang my gavel. There we are. We're not in session anymore.